Hi, I'm Alicia Cole. I'm an actress. I live in Los Angeles, California, and I've been an actress, been in the Screen Actors Guild for 19 years. In 2006, I found out that I had fibroids. So I thought, okay, well, if I get these fibroids taken out in August, I'll be healed, I'll be ready for the start of the television season. I was supposed to be in the hospital 2 days in and out. I had the surgery, but I never got better. It just spiraled from there. My breathing started becoming very labored, and my heart rate just went crazy. My abdomen was flaming red, and it was hard like cement, and it was on fire. My mother saw a black dot, like you took a Sharpie marker and just gently went like that. It took the doctor about an hour and a half to get back to the hospital. And he said, oh my, okay, now we need to be concerned. The black dot was like the size of a quarter. It looked like my skin had melted. He looks at my mother and he says, Mrs. Cole, are you squeamish? And my mother said, no. And he said, good, because I need you. I was terrified. To ask my mother to assist him and not wait and take me back to the operating room in a sterile, clean environment, to take a tray with gauze and put it in the windowsill overnight, and then take that same tray, lay it across my legs, and start pulling gauze out of an already open box. And they basically use their hands to pull open my incision. I've never felt that kind of pain, ever in my life, ever. The infection was spreading about an inch every hour on the surface, so even more underneath. So the infectious disease specialist should have been there that night, but she didn't come until the next afternoon. No one really paid attention to the signs and symptoms that I had. In that hospital, starting from the top down, there was a lack of consideration for the patient. It wasn't until after that, a few days, that the doctors verbally told my parents what I had. Sepsis, Pseudomonas, VRE, MRSA, and necrotizing fasciitis, flesh-eating disease. It was an indication of a total system breakdown. I was in a prominent, beautiful facility. I did my homework. I did what an engaged patient is supposed to do. I was proactive. But my 2-day hospital stay for routine fibroid surgery went from 2 days to 2 months in the hospital, a month in ICU, 9 blood transfusions, 6 additional surgeries, almost having my left leg amputated. I had a year and about 2 months of twice-a-day home health care nurses. I had an open abdomen for 3 years that would drain. Physical therapy off and on for at least 4 years. Doctor's appointments every week for the last 7 years. And over $2 million in medical bills. I used to have a lot of faith in the system. When I see what's happening in healthcare and people who it's just a job and coming to take care of a woman who's missing her abdomen, and I don't bother to read her chart before I get there. Or I don't bother to wash my hands. That kind of thing hits me at my core, because it's not how I was raised or who I am. We believe in honor and loyalty and truth and standing for something, no matter what the cost. My life is completely different. It's I was a cheerleader, volleyball, basketball, softball, ran track, bowling, you name it. So that's real hard. I had the most amazing support system going through this. It's what saved me, literally what saved me. There are so many patients who are by themselves, and that's why it's so important to me to speak out, to advocate, to give back. And I'm very, very proud to have been a part of the 2 laws for public reporting of hospital-acquired infection rates in the state of California. Our hospitals are scary places. Our healthcare system is broken, but there is hope. And that hope is patience, patient engagement, patient involvement. Albert Einstein says, you cannot fix a problem with the same mindset that created it. Patients bring a fresh perspective. We are the secret weapon, the magic bullet. Patience will change healthcare.